Welcome to our channel. Today, we're delving into the intriguing world of neuropsychology to explore Capgras Syndrome, a rare and fascinating condition that challenges our understanding of identity and reality. Capgras Syndrome is a psychological phenomenon where a person believes that someone close to them, typically a family member or friend, has been replaced by an identical imposter. This diagnosis can be perplexing not just for those experiencing it, but also for their loved ones. The syndrome is named after Joseph Capgras, a French psychiatrist who first described the condition in 1923. Although it's classified under the umbrella of delusional misidentification syndromes, Capgras syndrome stands out due to its distinct features. Individuals with this condition might firmly assert that their spouse, parent, or another significant individual has been substituted by someone who merely looks like them. Such beliefs can lead to misunderstandings, anxiety, and even conflict within relationships. But what causes Capgras syndrome? Neuroscientific research suggests that it arises from a disconnection between facial recognition and emotional responses. The brain processes the faces we see in a series of steps. Primarily, our visual system identifies the person, but a separate emotional response system evaluates that recognition based on familiarity and affection. In people with Capgras syndrome, the recognition system works correctly, but the emotional response is impaired, creating a divide. As a result, while the person recognizes the face, they lack the emotional connection, leading them to conclude that the individual cannot be who they claim to be. This syndrome is often associated with a variety of neurological conditions, including schizophrenia, dementia, and brain injuries. In some cases, Capgras syndrome can appear in patients suffering from degenerative diseases like Alzheimer's disease or as a consequence of traumatic brain injury. It can also manifest in healthier individuals after exposure to significant psychological stressors. The impact of Capgras syndrome can be profound. The individual experiencing delusions might exhibit paranoia, fear, or aggression, particularly if they feel threatened by the perceived imposter. This can strain relationships and create immense emotional distress for both the individual and their loved ones. Treatment is challenging and typically requires a multidisciplinary approach involving psychiatrists, neurologists, and psychologists. A combination of psychological support, antipsychotic medications, and cognitive behavioral therapy can be valuable in managing symptoms. While there's no guaranteed way to reverse the syndrome, therapy may help individuals navigate their perceptions and improve emotional connections with their loved ones. Educating family members about the syndrome can also foster understanding and patience, which are essential for effective communication during these episodes. Capgras syndrome highlights the complex workings of the human brain and the intricate nature of personal identity and recognition. Its impact shows us how vital emotional ties are in recognizing those we love. This condition reminds us how fragile our sense of reality can be and the importance of compassion in navigating the experiences of those affected. As we conclude today's discussion on Capgras syndrome, it is clear that this phenomenon, while rare, opens a window into the profound complexities of our perception of identity and belonging. If you found this informative, please leave a like, share it with those who might benefit, and subscribe for more deep dives into fascinating medical topics. Thank you for watching, and we'll see you in the next video.